also not labeled private. Patients are patients, and what we found which is not working here, and again in many facilities, is the flow of care, the care system that a government facility can easily refer a patient to a faith-based facility and get the same treatment. And we are appalled because we had put a lot of money in DHA, Digital Health Authority, to help network all the facilities so that when you get to a facility of your choice, you can easily be logged in and all your treatment uh, history are found and you're treated well. So that one we found missing here. We were even appalled to hear that ambulances cannot carry faith-based patients, so they labeled. We don't label as a committee. Those inhibitions should stop and have, because disease do not know them. If you delay, there will be disease progression and patients will die. And as my chair said, we also want to caution the issue of delays that leaves a facility like this closing, and now patients are everywhere. Others have even died in the process. That is not what we are envisaging in healthcare system. But we hope all will be well because as a committee we are very supportive to the new initiative which is going on. Thank you.
Bishop, Lord Bishop.
I want to register our gratitude to the committee, Parliamentary Committee of Health, for having made a visit to this ground of St. Peter's, St. Mary's Mumias Hospital, because of also what we have gone through. Even as you can see currently, we are not in operation because of the issue and the situation of the strike that happened 2 months ago, and because of lack of payment of the arrears of the salaries of the workers. We have met, and we are grateful that we are able to reach some point where SHA is agreeing to release some of those funds that we have been asking for, so that we are able to pay and have our work going on in operation. And having the committee, Parliamentary Committee of Health, has enlightened us quite a lot, because they are not just looking at St. Mary's, but St. Mary's has become also an area where it can also enlighten many others, because many other institutions are going through the same challenges, and yet we wouldn't have known exactly how to handle them. So as we look at the issue of SHA, we are getting, yes, SHA has begun, it's moving, but there are so many treating challenges that needs to be worked on, especially payment of the claims on time, honoring the claims if there is no problem, and being able to differentiate between those which have a problem and those that don't have a problem, so that they are paid. We are owed what we believe, because that's what we sent, what had been approved in the last regime of NHIF, over 143 million, which we believe is due to us. But you know, when it's said that we cannot pay because of the verify and so on, then somebody suffers. Somebody suffers, and that creates a hole that is not able to be filled in the short term, because we need money to pay the workers, we need money to run the functions of the hospital, and with that, then it becomes a challenge. In any case, we don't lose hope. I think we have had some discussions with SHA, and now that we have also presented our point of view to the parliamentary committee, we believe a lot of good will happen. I don't believe that we have been giving contradictory on figures on SHA. I think though for those of you who have now come to understand SHA, there is a time you talk now and the system can update another information so much so that the figures I'm talking about now, if they send 1 million into the system, would the figure be the same? So I think also it's important to understand these things. It's a flowing kind of information that is not static. So if I said it's 7 million last week and they have paid about 4 million, the difference is quite different. It's not the same. And I do not believe at any one time